Hey guys, my name's Ruth. I'm a health visitor in England. Throughout this video, I want to discuss what to expect at that first initial appointment with your health visitor. Now, this appointment tends to be around 26 to 38 weeks, depending on the availability of the health visitors in the trust. It usually is in the latter part. We do usually start to see you around 36 weeks plus. Now, what is a health visitor? First things first, a health visitor is a qualified nurse or midwife, a practicing nurse or midwife, and we have gone on to do an extra year of training. Now, this extra year of training is at university, and we have become specialist community public health nurses. My personal journey, I was a mental health nurse, worked on an intensive care unit, and then I went on to female ward, and I got this real passion for supporting parents with their mental health. And I met somebody who was doing their health visiting training, and then I went and pursued that myself. For a long time, I thought being a mental health nurse put me at a disadvantage, but now I've come to realize you cannot live your life without mental health problems, just like you cannot live your life without physical health problems. And I feel very passionate about supporting mums and dads throughout that journey, having had a baby. We abide by the Healthy Child Programme, or we implement the Healthy Child Programme. There are 5 core contacts without this programme. The antenatal, which is what I'm focusing on in this video. The new birth visit, which is completed around day 10 to day 12. We tend to, take over from the midwife then. The 6 to 8 week check, which is self-explanatory, between 6 to 8 weeks. A 1-year review, which can be completed between 9 and 15 months, where we're looking at your child's development. And then again at 2 years old, which can happen at 2 to 2.5. I can do videos on all of those at another time. Back to the antenatal. You should receive a letter in the post with an appointment date or a phone call. Health visitors don't tend to do unannounced visits. It just doesn't work for us, because if you're not in, then we could have been visiting somebody else, to tell you the truth. This visit, if you strip it back to basics, is information giving and information gathering, with a sprinkle of trying to build a nice relationship and a rapport with mum, dad, whoever the main caregiver is going to be. So throughout the contact, a health visitor is going to explain who we are, what we do. We support families until your youngest child is 5 years old. At the antenatal contact, we are ultimately providing a lot of health promotion information. We want to give you this before baby is here. We're going to retouch on it once baby is born. However, you're going to have a lot of other questions, and there's going to be a lot more to be done at the new birth contact. So let's get that health promotion information out the way in the first visit. We use a questionnaire called the Family Health Needs Assessment. Now, this is where we are going to ask you lots of questions. I appreciate health visitors can have a bit of a bad reputation. Some describe us as Marmite. You either love your health visitor or you don't like them at all. Some of the questions we ask can come across intrusive, and I want to explain a little bit why we ask these intrusive questions. They create a bigger picture for us, because when you have a baby, not to scaremonger, it can be one of the hardest times of your life, and we want to assess what level of support you may need from us as health visitors. In the Family Health Needs Assessment, we are going to want to know who's in the property. We ask for a family tree. How many other children do you or your partner have? Again, this is just building a bigger picture. All of these are tiny pieces of the puzzle that build a much larger jigsaw that we can then see what support you may need, what support have you needed in the past. Yes, we do ask, what's your financial situation? And this may seem intrusive to some. I have seen families who have nothing and require support with getting a crib, with getting food in the house, with getting clothes for their babies. You may be absolutely fine, but we have to ask to decide and decipher what support it is you may need. Another question people don't understand is why we ask sometimes, do you own your house or do you rent your house? Again, it's creating a bigger picture as to whether you may be moving again soon. People renting, they tend to move more frequently than people that have bought a house. So moving on from those questions, where there are a whole host, you don't have to answer if you don't want to. Health visiting service it's not a mandatory service. You can opt out. Yes, this is unusual, but you don't have to have a health visitor if you don't want to. We're here to try to help. We're not trying to catch people out. We're not trying to ask questions to, label you as something that you're not. It is purely to support you in a very tricky period of your life. We also go on to talk about your mental health, your partner's mental health, your physical health, things that may have been passed on to baby, which leads me on to, we also talk about what's going to happen when baby's born with the heel prick test, but I'll come back to that later. Also, we will be asking about smoking, drinking, illicit substance misuse, what medication you may be taking. This is all going to impact the way what support we provide and what health promotion information we provide. If you want to smoke and continue smoking, completely your choice, but we would like to offer, do you want to think about smoking cessation? And do you know the risks involved? We are public health nurses. Our main goal is to help people with their public health. You can go on to make whatever decision you like, but I would like you to make a decision having had that informed information, that evidence-based knowledge for you to make an informed decision. Let's get into the health promotion topics that are going to be discussed. I'm not going to go into detail in what we discuss in these areas. I'm just going to let you know which areas are going to be discussed. The immunisation pathway. This is when you can talk to your health visitor if you have any questions about immunisations, whether you know what the immunisation pathway is. And there's going to be access to either leaflets, depending on where you are, or a database or a website that you can go onto to view these leaflets. The NHS is trying to go paperless, I believe. Also, we're going to talk to you about how you're planning on feeding your baby, whether you're planning on formula feeding or breastfeeding. Then we can provide the support and the knowledge and the information around those two different types of feeding. Any questions you have that you want to ask as well. We're going to talk to you about bond, attachment, postnatal mental health, the baby blues, signs to look for where maybe you do need to get some extra support. This is where your support network is really important at recognising whether you're feeling or behaving differently to how you usually behave. All of this can be completely normal, so please do speak to your health visitor because we can support you with further visits or further avenues that we can direct you to help you with your mental health. Ultimately, we want to help you have the nicest postnatal period you possibly can because it's a really tricky one at times. We're going to talk to you about what the Healthy Child Programme actually is. I briefly touched on that earlier. What we're delivering in our visits, where you can access the support, how you can contact your health visitor, where baby weighing clinics are, all that type of stuff. We're also then going to discuss, your midwife hopefully has already, but we're going to discuss two tricky topics to discuss. They can be quite emotive, but they're necessary in supporting you. Sometimes it can come across as maybe fear-mongering, but we want to raise awareness of how it can be when you have a baby. First things first, something called ICON. Again, your midwife should have spoken to you about this as well. It's about high crying babies. Some babies just cry. And to tell you the complete truth, we talk about this in order to try to prevent cases of shaken baby syndrome, which is where a parent has got really, really angry. It happened. You might think I'll never feel like that with my baby. Trust me, we all do. Still now, my children are 5 and 6 and I'm still getting that frustration. We are there to talk to you about how to handle those frustrations, what to do, accessing your support network, and ultimately putting your baby down if you feel you're going to be really, really cross and leaving the room for to take some deep breaths. Also, we talk about sudden infant death syndrome and how to reduce the risk of it. This is a topic called safe sleep, making sure that you are aware of how your baby needs to be sleeping as safely as possible at night. Best practices, your midwife and health visitor should talk to you about how to co-sleep and bed share safely. I've spoken about this before. 9 out of 10 parents are likely to bed share at some point. It's important that you do it safely because Lullaby Trust have documented that up to 40% of parents are doing it unsafely. Again, I'm not going into this. I'll do another video about that, but you can look on the Lullaby Trust website about safe sleep and ask your health visitor or midwife about this. So, at your antenatal appointment, you should be given your parent-held child record. We call it the Red Book. This you are going to take to labour with you. Don't panic if your antenatal appointment hasn't gone ahead or you haven't been given your Red Book yet. You will get it. Don't worry. In this Red Book, there is so much information about immunisations, everything that is actually going to be discussed in your antenatal. There is information in here about that or where to access that information. Now, something that I always talk to parents about in this Red Book is the centiles. So this is where we plot your baby's weight, length and head circumference. I'll do another video on this as well. Ultimately, your baby is going to be born on a centile, a percentile, but we call it centiles. Now, no centiles right or wrong, but it's just a really nice way for us to log how your baby is doing. They're going to go up a little bit sometimes and they're going to come down a little bit sometimes. It's a rough, loose guideline as to how they are doing when it comes to their health and feeding. There is honestly so much information in this book. Like I said, there's immunisations, there's stuff about vitamin D, which also a health visitor will talk to you about. So babies who are being breastfed should be given vitamin D drops. And when you stop giving formula from 1 year plus, they should also be given vitamin D drops. Talks about screening and reviews. That's something else we'll talk about at the antenatal contact, what to expect when your baby is first born, the heel prick test, the checks that the doctor will be doing on your baby, the hearing test, all that kind of stuff we will be talking about at the antenatal contact. Another really, really important topic that we are talking about quite a lot now is baby brain development. I've touched on this in previous videos, but the first couple of years of your baby's life are actually incredibly vital to who that baby is going to become. But I'll talk about it again, like I've said in another video. Holding your baby as much as possible in those first few months is the perfect environment for baby brain development. It's an amazing environment for bond and attachment to improve. It's an amazing environment to help with promoting your breastfeeding if that's how you're choosing to feed. You don't only have to do it, the other main caregiver can as well. Skin to skin, another incredible place for baby brain development. Some cultures do this for 30 days. Mum and baby stay in bed doing skin to skin for the 30 days. I mean, I like the sound of that. I'd like to give that a good go. As you can tell, there is so much that we cover in the antenatal contact. If you feel I've missed anything or you have any other questions, please put in the comments below. Please do also have a look at my TikTok and my Instagram. I upload videos on there daily, and my Instagram I upload on my stories and put question boxes daily. I'll link where you can find me below. But please do not hesitate to have a look through this book, and if it brings up any other questions, you will be seeing your midwife and your health visitor at the antenatal, postnatal checks. You can ask them about all of this stuff. That is what we're here for. But good luck with it all, guys. So as always, guys, my name's Ruth. I'm a health visitor in England. If you liked this video, please give it a thumbs up, like, subscribe, follow, comment below if you have any other questions. You can find me on my other social media platforms at Ruth Watts HV on Instagram and TikTok. Like I said, I'm very active on those every single day. And I have created some guides. One is about toilet training, one is about fussy eating, one is about teaching a baby how to self-settle without leaving them to cry, and one is about handling naughty behaviour. Not that I believe children can be naughty. You can find that link in my bio. I keep them at the cost of a cup of coffee, so you can afford them. So please take care, and as always, praying to the sleep gods, calmness is your superpower. Yeah? Hey guys, me again. I know I've just asked you to subscribe, like and follow, but I just wanted to remind you all, at the antenatal contact, if appropriate, we will ask about domestic abuse. We will not ask if your partner is there, if a child over the age of 2 years old, I believe, is there. If any other adult is in the house, we will not ask you. But we are another port of call that if you are experiencing domestic abuse, you can reach out and we can help you with that. So I just wanted to add that in there. And I'll put some information down below. No.